look at it and you study it over time, the retention of those employees when they're invested in is just so great. And frankly, so is the access and the affordability.
By actually kind of navigating these new career pathways for them and helping them get to these critical roles that you're trying to fill, it really creates a sense of brand loyalty.
We're expected to have, roughly somewhere between 700 to 1.1 million leave the workforce.
There's a shortage of nurses, or, how do we find more nursing people and how do we get into the colleges? Hi, welcome to Talent Talk. This is Rick, your host today, and I'm joined by Geoffrey Roche, who is with RisePoint. He is the Senior Vice President of Healthcare Solutions. Geoffrey, nice to meet you.
Good to meet you too, Rick. Thanks for having me.
Yeah, welcome. So I guess let's get started and just tell me a little bit about what you do at RisePoint, what your role is there, and just briefly, just some of your career journey.
Sure. Yeah, so good to be here. Obviously, Geoffrey Roche. I had privilege of leading now at RisePoint what is called our healthcare solutions space as the Senior Vice President. That includes both our nursing subject matter experts that work with all of our academic partners, particularly in the nursing pre to post licensure programs, as clinical subject matter experts to support their needs on the academic end. And then obviously I also lead our employer healthcare partnerships team that works to secure clinical affiliation agreements, obviously that lead to clinical placements, and then look at other partnership opportunities, all at the bachelor, master's, post-licensure, and so on space within all the clinical and aspects of healthcare programs. Before RisePoint, served as the inaugural North America Director of Workforce Development at Siemens Healthineers, and had the privilege of serving there and building out a global ecosystem of workforce development within a global med tech company, which was a fascinating experience. And then obviously started my career as a hospital administrator through the influence of my mother, who's a nurse. And so always sort of bring that hospital administration experience into all the work that I do.
Great. Thanks for sharing. Yeah, that's, I saw that when I first connected with you that you have sort of that first love of nursing as part of your life. And so it seems to me that healthcare is near and dear to your heart. And so I think we can sort of use that as a springboard to talk about some of the things that I wanted to talk about today with you and really lean on some of your experience and expertise in the area. So, yeah, perfect. So let's start with just one of the big questions that I had off the top is just, I would love to know a little bit about your experience with creating career pathways and specifically for like frontline healthcare workers, frontline healthcare roles.
Yeah. So my experience, in that space in many ways goes back to, even my time in hospital administration, where I had the privilege, both in my own area where I served as a director, but then also in other parts of our organization to really look at, why and how is career navigation so important. And when I talk on these subjects, I always say, we have to look at it as both career and economic mobility, because ultimately, for so long in healthcare, we've always thought about degree to the experience, and that's, sort of the trajectory. But we actually have to think about earlier, K through 12, earning a credential if you can in high school, certainly earning experience while you're in high school, thinking about things like youth apprenticeship, going to apprenticeship, and continuing that idea of experience to certificate to certification onto degree. And so, even in my hospital system, I had built a program with our local university that was focused on actually supporting students who were in the academic programs earlier in their career, though. So they would be freshmen or sophomores who would come in and do a program and actually earn a credential as a health coach, and then actually provide care and support to patients, not clinically, but more in that support system type of environment. And we use that as part of our readmission program. And because of the success of it, we're able to knock down readmissions in high superutilizer patients. And again, that was before they were ever licensed. It was just, almost look at it as like a healthcare navigator type of role that obviously had a credential that we created. I think when you think about where we're heading in healthcare today with truly a crisis in workforce, the data suggests obviously it's only going to get worse. 2027 is coming, 2032 is coming. We're expected to have, roughly, somewhere between 700 to 1.1 million leave the workforce just in those timeframes. But then we have all the other people who are retiring as we go forward, and we don't have the supply to meet the demand. And so we have to build career pathways because every project I've been a part of, I did a work with Advent Health, for example, where I collaborated with them to build career pathways from their existing workforce, where we looked at what were the frontline roles that could tie to an allied health credential that would allow them to continue to grow their career, and then take that allied health credential and turn that back into credit for prior learning to come back for the degree. That work, I mean, in that project, several thousand Advent Health employees benefited from that project. And when you look at it and you study it over time, the retention of those employees when they're invested in is just so great. And frankly, so is the access and the affordability.
Yeah, I think that's a key point, is the fact that when you're working with your internal workforce, your incumbent workforce, by actually kind of navigating these new career pathways for them and helping them get to these critical roles that you're trying to fill, it really creates a sense of brand loyalty. It makes them feel like they're part of the organization, part of that growth. So I really like that you said that there, and that's very well done. So let me shift gears then a little bit. So as far as those frontline workers that may not be in the clinical setting, but more of like your patient transporters, your porters, your cafeteria workers, talk a little bit about your experiences with using some workforce development and the upskilling to try to attract those candidates to new roles that help fill those needs.
Yeah. I think, when I think about this, right, the career stackability idea of a pathway is super, super critical. We have less people who now know, for example, that they want to go on and become a nurse at times, or, go on and become a physician. We need to really give earlier experiences and awareness to individuals that can actually experience it earlier to get a sense of what they really want to do. And, recently I actually took a team from Rise Point. I've been there several times, but I just took a team from Rise Point up to University of Wisconsin Health, which has a phenomenal, in my opinion, one of the very best workforce development programs in the nation at a hospital system, where they have actually built their own allied health certification programs in-house, and built 3 now apprenticeship degrees with their local technical college. And what they did is they actually started with this idea of a career awareness. They call it HOPE. And their director actually built it out of her dissertation. Kind of beautiful when you think about it. Actually, her dissertation meant something.
Right.
She built this. And, they have, routinely every month where individuals from the school district, so students and families, come to the hospital and get to meet all the different people, learn about the roles, learn about the opportunities. And then ultimately they use that to then express out to those that are interested all the youth apprenticeship options they have during the year and summer. Then the students get hired and interviewed just like you would in any role. They get hired as a youth apprentice in all those areas. So they could be a youth apprentice as a medical assistant. They could be a youth apprentice in imaging. They could be a youth apprentice in, the cancer center, for example. They actually have defined roles. You get hired, you're an employee. And then they actually take programs at the hospital to earn the different certifications that then allow them to actually be, a certified medical assistant, for example. And then obviously, as soon as they turn 18, then they can move it into a very different model, whether it's an apprenticeship or go on and get that degree. And in their case, they built now 3 different degree apprenticeships with their local technical college, one in nursing, one in surgical technologist, and then one in respiratory therapy. And when you think about these models, in my opinion, whether you take their example or if you're an employer and partnering with a training provider to offer these critical programs that obviously take an individual from experience to credential, it is absolutely crucial. It is the only way, in my opinion, as somebody who's worked in hospital systems and worked with hospital systems my whole career, that you could ever get to having a sustainable future-ready workforce. You have to have these types of programs. Again, whether you do it yourself or you do it with a training provider, it is absolutely essential.
Yeah, and it's interesting too to hear that story that you told about the hope, and I think the name is speaks for itself. And in my experience, I've seen some of the clients that we've worked with that have had, front desk workers or very entry level workers that, like you said before, Jeffrey, like no idea what they wanted to do when they, got into the system. They didn't know that they wanted to be in the medical field. And they certainly didn't think that they'd ever had a path to some sort of credentialing or some sort of career growth.
Yep.
And by an employer standing up a program like you alluded to develop that workforce and to plant that seed, like, hey, there's a chance that you could continue to grow and better yourself and better your career. I've seen testimonials where, like, we were at a conference and literally two of the people that have completed a program similar to what you're talking about were literally in tears about how it changed their life and how the impact has been just, exponential. And they're going back to the offices that they sort of grew up in. And the patients that are coming in are now seeing them from the front of the house. Now they're in the back in the clinical setting going, wow, you made it. I didn't, I congratulations. You're now a medical assistant or a dental assistant. So, those stories are real life and they really hit home. So I love the fact that you've actually seen it firsthand too for yourself as part of some of the work that you're doing.
Yeah, and I've seen it as a leader. I had a colleague, Rick, that I worked with at my hospital system, who initially started as a health unit coordinator in our hospital system. Which was actually a credential, and essentially, kind of similar role to a patient care tech in many ways at the time. And then, she went on to, become the emergency department administrative supervisor in charge of all the scheduling for a 90,000 bed emergency room. Then went on, never earned a college degree, but went on to earn her emergency medical technician license to become an EMT. And, then went on to become a supervisor in that work. And then when I was her leader, I actually had to fight with the human resources department to promote her to be our first ever manager of EMS when we acquired an ambulance company. And what I saw in someone like her is so much of why these programs are critical. She was someone who was a single mother. She was literally making ends meet. In fact, sometimes I get teary-eyed when I remember this story, but there were times where she couldn't get gifts for her own daughter early on. And it was colleagues at the hospital, like myself, who supported that to happen for her. And, she ended up leveraging this career and economic mobility that was provided by the employer to earn additional credentials, earn additional experience, and ultimately become part of the management team. And do so because of the access that her employer provided, and also because she had a dream and passion and persistence to make it happen. And I can't stress enough that, today, with as challenging as the workforce is, every healthcare employer has to have scalable training solutions. And I don't know many that can do it on their own. And when you can partner with others to see that through and really make that life-changing, as you mentioned, impact happen, that's how you create retention. And that's how you have better care for your patients, because you're creating a loyal team member who's going to always want to come to that job with that passion and commitment, especially if you create the right environment.
Mm-hmm. Yeah, well said. And I think that a lot of things that I talk about with people in this space, especially in healthcare, is that you're in an environment where you're called to serve, and so that also goes both ways from the employer to employee perspective. It's nice that you can say as an employer that you're giving your employees an opportunity to better their lives and to better themselves and to grow. And so I guess let's talk a little bit about that, the growth aspect. So healthcare in general. So just if you think about the healthcare industry, Geoffrey, like, where do you feel that growth is headed, and sort of the need to fill those clinical positions, and what workforce development, what sort of upskilling roles, sort of play in that space?
So as far as I'm concerned, when we look at where we're heading, right, we have to recognize that less people will continue to go to college right away. It will become more common for us to think about how we engage our future workforce earlier, while they're still in middle school to high school, give them those experiences, do youth apprenticeship type of work, do apprenticeships, tie it to a credential. You shouldn't have any workforce program that's not tied to a credential. You have to tie it to a credential. There has to be something that they walk away with that experience with something that is going to allow them at age 18 to work in that role, to practice in that role. And then obviously provide those unique creative career pathways that allow them to grow. And so it should be very common when we think about a medical assistant to always think about, well, what's the next step for them? And how do we create a process where they go from medical assistant to central sterile to surge tech, for example, or medical assistant to patient care tech onto nursing, for example. Whatever they are, we need to have different career pathways and clear, articulated understanding of how to get there. That's just where we're heading. It also is the right way, both for the youth, but it's also the right way for career changers, because we know people change their careers. And I regularly say healthcare has historically been a space that has chutes and ladders versus actually career pathways, because so much of it has been so credential license based, which I understand. We haven't clearly helped people to understand how you get here from here. And that's why we have to have that clearly defined. And I think when you build out the programs, it's so important that you have that. People don't always know what they want to do, but if you show them and give them opportunities to learn about it, what we know is most people don't just stay as a medical assistant. Some do, but most don't. And so helping them understand, how that experience, that credential can get them to the next step is what I would say is most important.
Yeah. Yeah. And you're touching on something that I hear quite a bit in the people that I talk with are having the same problems. And it seems like, there's a shortage of nurses, or, how do we find more nursing people, and how do we get into the colleges? And it's like, what we're talking about today is exactly sort of a recipe to solve that, is work internally and to upskill your your CMAs and to have them go through that process to become internal growth, sort of that inside up mentality. So yes, I really like that idea. So I'll kind of give you the floor here to give your last words. If you want to talk about your vision of the healthcare of the future, or what you think we're headed towards, and give you an opportunity to let us know how you feel about the industry.
Yeah, no, obviously, like I've always said, I mean, it's been an industry that I've been fortunate and blessed to have literally in my life, my entire life. And, so passionate about this work. I can't stress enough about, there are some great examples out there of great healthcare systems doing really important and tremendous work with, training providers that also care deeply about career and economic mobility. I'm a big believer in the apprenticeship space, as you've heard me talk about, always have to tie that to a credential, and also big believer in we need to get higher ed to transform to think about degree apprenticeships. We have to think about everything through the modern lens of what healthcare needs. And we can't continue to take an 80s, 90s, 2000s view. This is a very different time in 2025 than where we've sat for so many years in healthcare. And there is no better place to serve from a career perspective than healthcare. But we have to provide the access and the opportunity and help people understand where they can play their space, special space, and where they can serve. And so, truly appreciate these types of conversations, because the more and more I'm out with the youth and get to see what they're thinking, and when they've had these experiences, they are captivated by the experience and they see where they clearly have an opportunity to serve. And we just have to give them that.
Yep. That's excellent. So yeah, I think that we both agree that you're in the healthcare space to serve, and that was well said. I think that, there is no better platform to do that and to serve. And I think that by also the employers serving their employees and helping them gain the skills necessary to get their credentials taken care of, that's something that they can never have taken away from them. That's something they'll take with them forever and will always continue on in their lives. So Geoffrey, I really appreciate our conversation today. I thank you so much for coming on Talent Talk, and I look forward to continuing the conversation with you.
Sounds good. Thank you for all that you do as well.
Yeah, I appreciate it. Thanks, Jeffrey. Have a great rest of your afternoon.
You.
Thanks.